This is my student support system. Keep watching, keep learning.
Diabetes mellitus is a metabolic disease characterized by increased level of glucose in the blood, that is known as hyperglycemia, resulting from defect in insulin secretion or insulin action or both. How we classify DM or diabetes mellitus? The major type of diabetes mellitus are type 1 and type 2. What is type 1 diabetes? Type 1 diabetes is much less prevalent than type 2. Type 1 diabetes affects only 5 to 10% of people suffering from diabetes mellitus. Type 1 diabetes has an acute onset, usually before 30 years, but it can occur later also. It is also known as juvenile diabetes or insulin dependent diabetes mellitus or IDDM. DKA, that is a complication of diabetes mellitus, is typically associated with type 1 diabetes. The causes of type 1 diabetes are: type 1 diabetes is caused by destruction of pancreatic beta cell, or we can say pancreatic tissue. Destruction of beta cells of islets of Langerhans of pancreas gland may be associated with genetic disorders, immunological problems, and possibly environmental factors. Regardless of the specific cause, the destruction of beta cell results in decreased insulin production. Type 2 diabetes. Type 2 diabetes is much more prevalent than type 1. It affects 90 to 95% of people who are suffering from diabetes mellitus, means more number are there. Type 2 diabetes can affect any age group, but it is more common among people older than 30 years of age. It is a chronic disease and slow progressive diabetes mellitus, normally DKA, that is a complication, we will study it later in this chapter, is not associated with this type of diabetes. So this is the basic difference. One is insulin dependent and it is not insulin dependent, and second is appearance of DKA. What are the causative factors of type 2 diabetes? Type 2 diabetes is caused by insulin resistance. The insulin production is okay, but there is resistance, or we can say that cells are not responding properly to that insulin. Insulin resistance refers to the decreased tissue sensitivity to the insulin. In type 2 diabetes, the intracellular reactions are diminished, making insulin less effective at stimulating the glucose uptake by the tissue and at regulating the glucose release by the liver. It leads to glucose imbalance or increase in the blood sugar level. What are the clinical manifestations of diabetes? Both type of diabetes leads to almost same clinical manifestation, because clinical manifestations of diabetes mellitus depends upon the hyperglycemia mainly. The typical sign and symptom of all type of diabetes include polydipsia, means increased thirst; polyuria, means increased urination, frequency of urination is increased; and polyphagia, increased appetite, client wants to eat more. Other symptoms include fatigue and weakness, sudden vision changes, tingling and numbness in the hands and feet, dry skin, skin lesions and wounds, especially in the feet that do not heal or very slow to heal, recurrent infections. What are the diagnostic investigation? How we will diagnose the client is suffering from diabetes. So number one is history taking and physical examination. If we properly take history and examine the client, then the sign and symptoms that we have discussed, if they are present, then we can think of that the client is suffering from diabetes. Then some investigations can be done. An abnormally high blood glucose level is the basic criteria for diagnosis of diabetes, and for this blood fasting sugar, random sugar, or glucose blood level after 2 hours of food, that is known as blood sugar PP, that we go for it. Treatment. The main goal of diabetes treatment is to normalize the blood glucose level and to reduce the chances of development of vascular and neuropathic complications, because once these complications occur, it is very difficult to reverse it. The diabetes mellitus management has 5 main components: pharmacological therapy, proper monitoring, nutritional therapy, exercise, and education. So these 5 activities can achieve our goal of diabetes mellitus. First is pharmacological therapy. Type 1 diabetes. In type 1 diabetes, insulin injection must be administered for the whole life, because the body loses the ability to produce insulin. So we have to give it from outside. That's why we call it IDDM, insulin dependent diabetes mellitus. And in type 2 diabetes, oral hypoglycemic agents, means oral medicines, are sufficient to control the blood glucose level. But sometimes the client may need insulin injections for some period of time, not for whole life. So this is the basic difference in the treatment of both type of diabetes. Other modalities, other 5 points, they are same for both type of diabetes. That is monitoring. Second is monitoring after pharmacological management. Blood glucose monitoring is very important in diabetes mellitus. Using frequent SMBG. SMBG means self-monitoring of blood glucose, and learning how to respond to the results enables people with diabetes to adjust their treatment regime and to obtain optimum blood glucose level. Next is nutritional therapy. The main goal of nutritional management of diabetes is to control total calorie intake and to attain and maintain reasonable body weight. Control of blood glucose level and normalization of lipid and blood pressure prevents heart disease also. The patient should strictly adhere and follow the diet chart prescribed by physician or dietitian. Exercise. Exercise lowers the blood glucose level by increasing uptake of glucose by body muscles and by improving insulin utilization. Resistance training such as weightlifting can increase muscle mass, thereby increasing the resting metabolic rate, and ultimately this will reduce the glucose level. Ideally, the patients with diabetes should exercise at same time and in the same amount each day. Education, that is health education, we can say. Diabetes mellitus is a chronic illness and it requires a lifetime special self-management behavior. Patients need knowledge regarding basic details about diabetes, self-monitoring of blood glucose, self-administration of insulin, effective diet and menu planning, exercise schedule, recognition of our self-respect or self-life, treatment, and prevention of complication. So proper health education should be provided.
My student support system. Keep watching, keep learning.